Sloppy science, shortcuts, and scientism. A set of systems lessons from our present era of the pandemic known as COVID-19. I'm Michael
Hi, I'm
Lissac,
Brendan.
the immediate past president of the American Society for Cybernetics and professor of design and innovation at Tongji University in Shanghai. The past 2 years of the COVID pandemic have created a set of very interesting lessons for both cybernetics and the systems communities in general. This presentation is going to look at one aspect of those observations, the role of sloppy science, and what that means for how we go about scientific inquiry in almost all endeavors.
I'm Brendan Mayer, Michael's research associate and a senior at Boston University Sargent College. Michael is going to focus on the systems and cybernetics aspects of this presentation, and I'm going to focus on the questions of public health. The general public and our political leadership was unprepared for a pandemic disease which had a huge number of asymptomatic carriers. Because people who were contagious often displayed no symptoms, our normal defenses about how to behave no longer worked. The longer COVID-19 stayed with us, the greater these uncertainties became. COVID-19, like other public health issues, requires an explanation longer and more complex than that which the media will allow for. Due to the nuance of a novel disease, many parts of it are unknown. Last year, when the body of science agreed on certain parts of the virus's structure, we still had yet to understand the way it spreads from human to human. If the public is given an incomplete story with a conclusion that is not backed by science, they see no need to fill in the gaps with research because to them, there are no gaps. Sloppy science is the practice of science without attention to detail and rigor. Shortcuts are taken and used in place of time and diligence. Alternative choices are ignored due to their disruption to the already assumed conclusion or other reasons. Desired results exist because of political pressure, financial incentive, the fear of more people dying, or the clout that comes from finding the cure. Bias abounds when the incentives are so strong. Desired results are found more often than not. Hydroxychloroquine was pushed as a cure for COVID-19 on the basis of sloppy science. Although many in the medical community warned that the conclusion was being pushed on the basis of a poorly designed study and anecdotal evidence, the hope for a miracle cure resonated with journalists, decision makers, doctors, and scientists. Given one paper on hydroxychloroquine, both the media and policymakers reacted as if the small-scale study involved was conclusive. Rigorous science would mostly disprove the hydroxychloroquine treatment as effective against COVID-19, but only months after it first soared in public expectations. Perhaps most troubling, these shortcuts, manifested as labels and categorization, led to an erosion in the public's trust in science and scientists. The strong emphasis for and against masks was made without consideration of key variables, including the roles of aerosols, the concentration of exposure, ventilation, and others. Nor was it communicated to the public properly so that citizens would understand the reasons behind the policy. Many decisions were hastily made regarding mask wearing without proper science or proper logic. In February, there was a lack of RCT studies for face mask effectiveness against aerosol transmission, and masks were being used in every hospital that had them. But still the messaging to the public was masks don't work. The CDC recommended that citizens not wear masks, but healthcare workers should. What about homemade masks? The CDC failed to think about the nuance of such labels. Masks don't just have to be an N95 to help. Even though the CDC made the recommendation in April for mask wearing, it was much too late. Lives could have been saved with a full explanation in February about the entire situation surrounding masks and COVID-19. The sloppy science surrounding COVID-19 led to the obsession of fomite transmission. Not only did this cause unnecessary anxiety, but this also took the focus away from the danger of aerosol and airborne transmission, which are the main causes of COVID-19 infections. The rush for reasons of COVID-19 spread led to this over-focus of an issue that required much deeper explanations than clean surfaces and wash your hands. The media wasn't ready to convey that message, nor were they willing to admit to viewers that scientists didn't have all the answers. In Hong Kong, COVID-19 samples were collected from touch sites at a Buddhist temple, the site where an outbreak occurred. Then, the New York Times reported this as a big fomite outbreak. This is a great example of jumping to conclusions, whether it's the media or the public's interpretation of the science, it's still sloppy.
COVID is happening in an era that is devoid of a dedication to rigor. Instead, we have truthies, as invented by Stephen Colbert, the notion of TLDR, too long, didn't read, which seems to be a byword of many of our students and many of our managers, and TCUSI, too complex, used a shortcut instead. It is those use of shortcuts that adhere to truthies, shortcuts that substitute for that which was too long and not read, that get us in trouble. Indeed, when sloppy science was first given the term Schlotterwettenschlapp, it was this taking of shortcuts that got Derek Stapel in deep trouble. Sloppy science needs to be distinguished from good science. The difference is between asking questions and relying on shortcuts. Good science starts with an unexpected observation. There's some confusion about something that is seen or perceived. The researcher then asks, what is it that should be examined? That question can only be answered when many others are answered. What kind of constraints are being faced? What context is the scientist in? What kind of resources are available? There's also a question of presuppositions. What is the correct unit of analysis? What is a measure of success? How do I understand what kind of category I'm dealing with? How do I know which context is the right one to be looking at? These questions are all explored in the nature of relationships, i.e., what gets examined keeps getting changed by the answers to constraints, context, presuppositions, and what is being uncovered. Eventually, there is enough data, enough understanding of context that the scientist can develop a model. Not one model, usually many models. Models that are run themselves with sensitivity analysis. Within a model, there is induction and deduction being used. The idea is, can a narrative be developed that tells us something about understanding? Once that narrative exists, it sheds light on the scientific question that was the beginning of this quest. But notice, category, label, narrative, in good science, they come at the end. In sloppy science, they come at the beginning. When the science is sloppy science, shortcuts, narratives, and pet theories are used to filter the observations seen, the methods and techniques employed, the narrative that is subsequently told, and all of it is packaged much like one of Stephen Colbert's truthies. It has to feel right. It's not that the data has to support it, but rather that the feelings must support it. Sloppy science is a science of shortcuts, dangerous shortcuts. When I look at this kind of shortcut issue from the perspective of cybernetics, several things immediately jump out. Taking a pet theory, using it as a shortcut, is to limit the variety that is being applied to the situation. Requisite variety no longer is present. Instead, what is being looked at is narrowed to the variety present in the pet theory. We no longer are examining a phenomenon, a situation, an unexpected observation. Instead, we are examining something with blinders and frames. We are examining something that is the product of a pet theory. Second, we all are human, and humans follow, in general, what is known as the least action principle. We will not embark on more work when there is a simpler path to be followed. The mere offering of a pet theory, the offering of a shortcut up front, is least action. It is simplified. That simplification has one more clear and present danger: scientism. If we label the shortcut as science, if we suddenly give it extra legitimacy, we've narrowed requisite variety, we have embarked on a dangerous path of least action, and we have foreclosed ourselves from exploring what perhaps are the real things that are going on. It is not like the sloppy science that is engaged in is done so out in the open. It is done in the guise of a black box to which the practitioners attach the magic label science. What really happens is there is this pet theory or shortcut. All that enters the black box is filtered against the pet theory. What does not match never makes it in. The processes that occur in the black box are those which conform to the pet theory. And surprise, that which emerges from the other side of the black box, again, conforms to the pet theory proclaimed at front. If we are looking for confirmation, we get it, because it is a self-fulfilling prophecy. Only that which matches the confirms of the black box, of the pet theory, survive.
Just a quick example of what can happen when sloppy science occurs. Hydroxychloroquine was prescribed unnecessarily many times. Some people who needed the drug couldn't get it because the drug was in short supply because it was being overprescribed. And also doctors felt pressure from their patients to prescribe this drug even though it wasn't the best course of action.
As if the dangers of hydroxychloroquine were not enough, now we have ivermectin. Sloppy science continues. So does the distrust in science in general. All of this creates a huge chasm of doubt. Do the vaccines work? Don't they work? Who should take them? When? How often? With a booster? Without a booster? Should we be wearing masks? When? Why? Should we have an economic lockdown? Should we be social distancing? Should our children be going to school? Should the elderly be kept at home? Not knowing clear answers to these things creates ample doubt, and that doubt feeds on itself. When the black box of sloppy science cannot quell the doubts, all that happens is fear, uncertainty, and confusion. Our goal must be to take the steps necessary so that the public can once again regain its faith in science. To do so means we need to bring back the notion of rigor. We need to bring back the continual asking of questions. We need to reassert that science is not about answers, but is about questioning. It's about a process. It's being open to say, I don't know. I don't yet understand. Come on this journey with me. We cannot have the false truths, the black boxes of sloppy science, work to destroy what has been the 20th and 21st century's greatest achievements. Science and technology have done wonders for mankind. Sloppy science, fear, doubt, all of those can work to destroy that. It is critical that we work to restore our trust in science itself. That trust can happen when we once again approach science from the perspective of systems, cybernetics, and asking questions. On behalf of Brendan and myself, thank you for listening.